This is the wrong way to wear a mask. Don't do this. What's the right way? I'll show you. So what are some of the things that dentists and hygienists and assistants are doing wrong with their facial masks?
So dentists and hygienists don't necessarily know how best to use the mask. And so they'll often wear their mask inside out with the color facing in, and the color is supposed to be on the outside. So it's important when you're putting on the mask to have the color facing out. And you want Medicom, you see Medicom has their brand on the bottom, so you want that to be on the bottom. You want the nose piece on the top and that on the bottom.
Okay. Perfect.
Because of the way that the masks pleat, if they're worn backwards, you'll get gaps on the side.
So color out, number one.
Color out. Another thing is the way that they put on the ear loops. So sometimes they'll cross the ear loops, like so. And pink is not my best color.
I think it looks smashing on you.
So this is how you're supposed to wear the ear loops.
Right.
But sometimes you'll get, for tighter fit, clinicians will go and cross the ear loop over, but that causes gaps on the side. So those are some of the things that
don't cross the loops.
You don't want to be doing. And you definitely don't want to be wearing the mask for too long or in between patients. Sometimes clinicians will what they'll do is they'll be wearing the mask and they want to go out of the procedure room, they'll pull it down below their chin, and then they'll come back and they'll pull it back up. And that's definitely a no-no. Cross-infection, cross-contamination can happen.
For sure.
Very easily.
I've seen a debate recently online where dentists were saying, I use one mask for 3-4 patients. They change it just kind of indiscriminately at some point when they feel it's getting dirty or something like that. I change my mask between every single patient. Mm-hmm. That would be the advisable way to do it. Yes.
That's right. So, and if you are in a procedure that's a little longer, you'll want to change your mask when it's difficult to breathe through, because that means that your mask filter is saturated and you're no longer filtering out the bacteria. So if you're having difficulty breathing through a mask, you know that it's time to change it. And if there's any splash, so if you get splatter or splash on the mask, even if it's after 10 seconds, you definitely want to be changing.
It's in your own best interest to do that.
That's right.
Yeah. Now I have an age-old question. How do we prevent fog on our glasses and on our loops?
That's a good question. So you want to make sure you're using a mask that has a very strong nose piece. So often imported masks or cheaper masks will have these sort of twist ties that are used as opposed to an aluminum nose bar. The best quality is the ones with the aluminum nose bar. That will give you the best fit, and you need to make sure you're pushing down on it and molding it to your face. That'll give you the best airtight seals.
I'd like to put this mask on, and can you grade me to let me know if I've done it correctly?
Sure, so you might want to use a
different one. That was a test. Thank you very much. Okay, here we go.
Maybe pink will look better on you.
I'm going to see. It's my color, I've been told. Here we go. How'd I do?
So pretty good. You want to push along your cheeks.
Oh, like really get the whole area, so not just the nose.
Right.
I find this helps me with the fog. If I pinch down here, it's usually not a problem. But also do a little one of these.
Right. Make sure that you're getting very tight fit.
This is a very comfortable mask. Are there any other features that you have in the mask that you find dentists should look for?
This is our newest mask. This is the Master Series mask. We've recently redesigned it with Simply Soft technology. And what that is a inner layer that is a perfect balance of breathability and softness. So that's the two attributes that best represent comfort. You don't want a mask that makes you too warm, so you want something that's breathable, pretty easy. And at the same time, you don't want it irritating your face. And so a very soft mask that will not absorb the moisture will keep your face feeling
It's very comfortable.
irritated.
Right.
Yeah. It's a very nice mask.
Thank you.
Great.